Shows the technique for making a single appointment bridge using Ribond reinforcement fiber, which is perhaps the most common Ribond application worldwide. These bridges are quick and easy to make and very well received by patients. Please note that this video is intended to provide an overview of the procedure and that it is not intended to be used in lieu of the instructions that are included in the Ribond kit. A Ribond bridge can be made either intra or extracoronally, depending on the particulars of the specific case. This video shows a case without preparations to the abutments. Whether preparations are used or not, the technique for making the Ribond bridge is more or less the same. If the abutment teeth are periodontally mobile, the Ribond wings can be extended to multiple abutments. First, you will need to decide what to use as a Pontic. If you just extracted a natural tooth, you can use it as the Pontic. You can also make a Pontic using an acrylic denture tooth or a freehand composite buildup. You will want to choose and shape the Pontic prior to making the Ribond framework. Measure the area where the Ribond will be placed using the dead soft tinfoil provided in the Ribond kit. Waxed dental floss can also be used as well. Then cut the Ribond to the corresponding length. A small amount of tacky composite can be used to help hold the template in position. 2 layers of Ribond will be used for making the bridge framework. The first layer will extend from abutment to abutment. The second layer will double up against the first layer only in the Pontic area. Adapt the tinfoil or dental floss to the teeth as you would adapt the Ribond. Cut or mark the end of the template to indicate the length that will be needed to cut the Ribond. Please note, you may want to err on the side of cutting too much rather than cutting too little, as you can trim the excess Ribond with the special Ribond scissors before polymerizing. Cut open the plastic packaging and use cotton pliers to extract the Ribond. Cut the 2 Ribond pieces with the special Ribond scissors. Ribond is made from the same ultra-high molecular weight polyethylene fibers used to make bulletproof vests, and normal scissors will not cut it cleanly. Reseal the Ribond by folding over the end of the packaging and securing it with the paperclip. This will help maintain Ribond's indefinite shelf life. Clean the teeth and prepare the teeth for bonding. Clean and acid etch the teeth and apply the bonding adhesive using your standard bonding technique and materials. Please note that since there is no clinical evidence supporting the use of self-etching resins for this type of retentive bonding, we do not recommend using self-etching resins for this procedure. Apply a thin layer of Ribond securing composite or soft filled composite to the teeth. We don't recommend using a flowable composite for this step because flowables tend to lack the tackiness to hold the Ribond in position prior to curing. Ribond Incorporated has a specially formulated filled composite resin designed for bonding the fibers to the teeth. It has a viscosity that is between a flowable composite and a filled restorative composite. This video shows the technique using the Ribond securing composite. If you do not have the Ribond securing composite, we have a list of some of the composite resins from major manufacturers that we recommend for this step of the procedure. Using a paste viscosity composite, place a thin bead of composite on the teeth and then with an instrument flatten it to mimic the contours of the teeth. Flattening the composite will make adaptation easier and reduce the amount of composite that needs to be displaced when placing the Ribond. Try to make this layer approximately 1/2 millimeter thick. Wet the first piece of Ribond with a 4th generation unfilled adhesive bonding resin. After the Ribond is wetted with the bonding resin, you can now touch it with your fingers or powder-free latex gloves. Do not wet the Ribond with a bonding resin that contains a Denton primer or self-etching component. If you do not have a suitable resin already in your office, Ribond Incorporated offers Ribond wetting resin, which is specifically designed for wetting Ribond fibers. Hold the wetted Ribond with cotton pliers and starting at one end, press the Ribond into the composite resin that was previously applied to the teeth. Use your fingers or instruments to press the Ribond through the composite closely against the tooth surfaces. Remember, the thinner the bond line is, the better the results, so try to displace as much composite as possible. This will not only minimize bulk and aid in patient comfort, but it will also maximize the laminate effect and increase longevity. Use cotton pliers and bring the Ribond across the edentulous area and adapt the Ribond into the composite on the other abutment. Again, place the Ribond as close to the surfaces of the teeth as possible. If the Ribond piece is too long, cut the excess with the special Ribond scissors prior to curing. Try to make the ribond cross the pontic space in a straight line, and orient the ribond so that it is placed under the incisal edge of the pontic. This way, the forces from the pontic will be directed onto the ribond framework. After placement, using the same thin-tipped instrument, carefully remove the excess composite resin that was displaced during the adaptation of the ribond. Move the instrument parallel to the lengthwise orientation of the ribond to avoid accidentally displacing the ribond. After the first piece of ribond is adapted, polymerize the framework according to the composite manufacturer's instructions. Wet the second piece of ribond with a bonding adhesive that does not contain a dentin primer or acid etchant. Place a thin layer of the same filled composite that we used earlier for the procedure on the lingual side of the ribond in the edentulous area. Extend this composite layer onto the interproximal angles of both abutments. Gently place the ribond against the layer of composite. Try to maintain a 0.5 mm thickness of composite resin between the two layers of ribond. Polymerize the second piece of ribond. If using an acrylic denture tooth or a natural crown as a pontic, cut a lingual channel to accommodate the ribond framework. If using an acrylic denture tooth, you will be relying on mechanical retention, so make undercuts within the groove preparation in the acrylic denture tooth. Small holes can be placed in the groove for added mechanical retention using a small burr. Fill the groove with composite, seat the pontic on the framework, check placement, and polymerize. Cover the ribond within the channel of the pontic with composite to build up the lingual side of the pontic. Cover the lingual surfaces of the ribond wings to make the prosthesis smooth and comfortable to the patient. For extracoronal applications, we recommend a flowable composite for covering the lingual wings of the abutments. This can be applied in multiple layers using a micro brush or other small brush to make the wings smooth and comfortable for the patient. Do not use the ribond securing composite for the covering layer, as it is too tacky. Ribond fibers do not polish well, but they need to be covered with resin. You want to avoid having to shape and polish the prosthesis using rotary instruments. When the covering layer is finished, thoroughly polymerize.